15th. Now, joining me now to discuss the impact of these changes on the community and the city of Cleveland is the city's Director of Public Health. That's Dr. Dave Margolius. Dr. Margolius, thank you so much for joining us.
Yeah, thank you. Thanks for having me.
We want to start first and talk about there's going to be this level of transition in terms of when this hospital closes, particularly the ER. People will have to be educated to know that they can no longer come here for services. Is the city planning to do anything to help assist with that?
Sure. So I think the most important thing for this community is that St. Vincent isn't leaving. They're still here. They're still going to be here for primary care, for addiction, behavioral health, and urgent care. And so if folks show up here, someone will still be here. For emergency care, they will be directed to other hospitals. And in Cleveland, we know we have plenty.
And let's talk about that, because you're talking about what is walking distance for some people will now not be walking distance. So what does that mean in terms of moving to another hospital? What's the nearest hospital?
The nearest hospital from here is probably Metro Health on West 25th, and so not too far. I think if someone can walk in that might not be having an emergency, and so the urgent care will still be here to take care of folks.
Okay. And is there a plan for those 500 workers that are going to be losing a job very soon?
Yeah, I think the most important thing that Sister Judith Ann and the leadership of St. Vincent Hospital said to us was how much they care about their employees, and they have worked it out with University Hospital to make those first offers for the 600 employees that will no longer be working at St. Vincent. And we know that across town all the healthcare systems are really looking for employees, and so I think other than the change, the folks here will be okay.
And let's talk about the history of this hospital. It's been here for a long time. Did you foresee this happening?
I think that the healthcare community in Cleveland has long suspected that it would be hard to stay open for the St. Vincent inpatient unit. We look at all the small hospitals that have closed over the last 30 to 40 years, and somehow St. Vincent inpatient unit has stayed open. They're really just sheer goodwill and a miracle from the folks who work here. And so the community will be okay without their inpatient services, but we're so glad that they'll continue to serve this neighborhood through primary care, addiction services, behavioral health, and urgent care.
Dr. Margolius, thank you so much. So many changes in terms of healthcare and the landscape here in Cleveland. We could talk all day about it, but we appreciate you being with us.
Yeah, thank you.